Number 2 is nutrition. Nutrition, calcium plus vitamin D. Take with 1 glass of milk. It means if we are taking vitamin D, we need to take calcium also. Iron plus vitamin C. To take empty stomach with citrus food. Drink it with help of straw. Complication of iron therapy is constipation, so we have to increase fiber diet. Then next is source of energy. Carbohydrate, protein and fat. It contains fat soluble vitamin A, D and E, K. Next is NG tube or RT feed. For insertion of the tube, we need to make right lateral position and measurement tip of the nose to the earlobe to the xiphoid process. If first time we are inserting RT tube, then we will confirm with X-ray. Each time before feed, we have to give semi-fowler position, or we can check tube placement with help of stethoscope, and aspirate the content and check gastric pH. Normal gastric pH is 3.5 to 4. If it is greater than 6, it means our tube in small intestine. Withhold the feed and inform to the physician. If aspirated content is 100 or more than 100 ml, then withhold and inform to the physician. If patient complain of nausea and vomiting, then check the patency of tube, then inform to the physician. After each feed, we have to flush with 10 to 20 ml of water. NG tube is short term. Next is gastrotomy feeding. It's a long term feeding method. We have to maintain the patency of tube. We have to flush 2 to 4 hourly. It's a surgical procedure, so no need to check. Next is parenteral nutrition. Nutrition by the vein, TPN. After starting TPN, we have to monitor blood glucose. Immediate complication of TPN is hyperglycemia. 75% of TPN is carbohydrate. So never stop the transfusion quickly or immediately, because to prevent hypoglycemia. Change the tubing 24 hours. Maintain aseptic technique. Only insulin and heparin we can add with TPN. Other complication of TPN are fluid overload. How to check? Unilateral or bilateral crackle sound. Inform the physician. Then next is pulmonary embolism. Pulmonary embolism, we will see sudden pleuritic chest pain with dyspnea, anxiety or restlessness. Then management of pulmonary embolism. You have to remain with the patient and activate RRT, rapid response team, by another nurse. Elevate the head of the bed, administer 100% oxygen or send ABG. Administer anticoagulant, low molecular weight heparin, and prepare patient for thrombolytic therapy. Thrombolytic therapy, streptokinase, urokinase and TPH. Monitor for the bleeding and initiate the bleeding precautions. Patient needs long-term anticoagulant therapy. Decrease or avoid vitamin K. It's green leafy vegetable or animal product. We will administer heparin, or antidote of heparin is protamine sulfate. When we are administering heparin, we will send APTT or PTT for lab. And another one is warfarin. Warfarin antidote is vitamin K. Then with warfarin we will send PTIN.